Coughing is your body's natural response to anything that irritates your throat or airways. The irritant stimulates nerve endings that send signals to the brain. In turn, the brain prompts the muscles in the chest and abdomen to expel air from your lungs, trying to push the irritant out. Occasional coughing is common and healthy. However, a persistent cough that lasts for several weeks or comes with bloody or discolored mucus might be a sign of a health issue that needs medical attention. Sometimes a cough can be so forceful and long-lasting that it irritates the lungs further, creating a vicious cycle. A strong chronic cough may lead to insomnia, dizziness, fatigue, headaches, urinary incontinence, vomiting, and even broken ribs. When is a cough considered chronic? While occasional coughing is normal, a cough that lingers for weeks or is accompanied by alarming symptoms may signal a problem. A cough is considered acute if it lasts less than 3 weeks, and chronic if it lasts more than 8 weeks in adults, or more than 4 weeks in children. Common infectious causes of acute cough. Acute cough is often caused by infections or worsening of chronic lung conditions. These may include acute sinusitis, bronchiolitis, especially in young children, bronchitis, the common cold, croup, mainly in children, influenza, laryngitis, pneumonia, respiratory syncytial virus, and whooping cough, also known as pertussis. Note: some infections, especially whooping cough, can trigger prolonged coughing spells that last weeks or even months after the infection clears. Common pulmonary causes of chronic cough. Chronic cough is often linked to underlying lung or heart issues. These include asthma, which is most common in children, bronchiectasis that causes mucus buildup, sometimes mixed with blood, chronic bronchitis, chronic obstructive pulmonary disease, cystic fibrosis, emphysema that causes shortness of breath, lung cancer, pulmonary embolism, sarcoidosis, and tuberculosis. Other causes of cough. Non-pulmonary causes of cough may include allergies, choking, especially in toddlers, chronic sinusitis, gastroesophageal reflux disease, or GERD. Heart failure can also be a factor. Inhalation of irritants like smoke, dust, chemicals, or foreign objects is another cause. ACE inhibitors, which are a type of blood pressure medication, can lead to coughing too. Neuromuscular diseases affecting coordination between the airways and swallowing muscles can play a role. And finally, post-nasal drip, where mucus drains from the nose into the throat, can also cause coughing. When to see a doctor. See a healthcare provider if your or your child's cough lasts longer than a few weeks, or is accompanied by any of the following symptoms: thick yellow or green mucus, wheezing, fever, shortness of breath, fainting, swollen ankles, or unexplained weight loss. Seek emergency care immediately if you or your child experience choking or vomiting, difficulty breathing or swallowing, coughing up blood or blood-stained mucus, or chest pain. Cough medications are typically only used if the cough is new causes, major discomfort disrupts sleep, and is not accompanied by worrisome symptoms. Always follow the dosage instructions carefully if using any medication. Important notes: over-the-counter cough and cold medicines do not treat the root cause and may be no more effective than doing nothing. These medications are not recommended for children under 12, and are especially dangerous for children under 2 due to the risk of overdose. To help soothe a cough, try the following cough drops or hard candies. They soothe throat irritation but are not safe for children under 6 due to choking risk. Honey, a teaspoon can help calm a cough. Do not give it to infants under 1 year due to the risk of botulism. Humidify the air. Use a moderate humidifier or take a steam shower. Stay hydrated. Fluids thin mucus. Warm drinks like tea, broth, or lemon juice can soothe the throat. And finally, avoid tobacco smoke. Both active smoking and secondhand smoke can worsen the cough.